Hello, my name is Amber Jones. I'm doing the NG insertion. I'm in the right attire from my school, and I also have my name badge on. I have lubricant with me. I have a 60 ml syringe. I have a basin. I have tape to secure and to measure out my measurements. I have an 18 French NG tube. I also have something to place along my patient's chest. I have a pin to pin it to her gown when I'm done placing it. I have a pin light to assess her airways. So yeah, let's get started. I'm going to knock on my door to let her know who I am. Once I get inside, I'm going to introduce myself, let her know my name is Amber Jones. My name is Amber. I'm the nurse that's going to be inserting your NG tube. The doctor has placed for you. I'm going to verify her name and birthday, asking her, can I get your name and birthday, and then verify it with her name bracelet. Then I'm going to make sure the door is closed for her privacy. I'm going to do hand hygiene. I'm going to wash my hands, and I'm going to place gloves on. After I do that, then I'm going to walk her through the process that I'm going to be doing with the NG tube. And I'm going to start by assessing her nasal way, her nose and her nares. So I don't see anything that's concerning. I don't see any redness, any swelling. I don't see any mucus buildup. It looks pretty good. So I'm going to go ahead and have her press on one side of her nose and breathe out and see which one it has the least resistant. She said it's her left, so I'm going to go ahead and start. I'm going to place my NG tube in warm water so it can kind of loosen up and soften. As I'm doing that, I'm going to open up my lubricant. After that, I'm going to grab the NG tube, and I'm going to just measure it from the tip of her nose to her ear to her pharynx process. That's about 47 centimeters, and I'm going to go ahead and tape that. To let me know that's where I need to be at. Now that I did that, I'm going to go ahead and dip the tip of my NG tube in lubricant. I'm going to make sure Marie has her water near her, so when need be, she could take sips as I'm doing this process. To start off, I'm going to have Marie tilt her head back so I can, when I'm going into her airway, I can direct it down and make sure it goes to the back and not up towards her brain. So I'm going to have her lean back a little bit. Are you okay, Mrs. Marie? Do you feel any resistance yet? Do you feel like you're about to gag? Okay, this is the point where you need to take the cup of water and take small sips, and well, not small sips, but take some sips. And as you're taking the sips of water, I'm going to pass the NG tube through as you swallow. And as you're doing this, I'm going to have you tip your head forward, chin to chest. Okay, chin to chest. Okay. Go ahead and take a sip of water. Okay, take a sip of water. 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 Okay. Now that the NG tube is at the line, I'm going to grab a piece of tape that I have over there. I'm going to rip it down the middle. Place that over like so. I'm going to secure the tape to her nose by wrapping one of the pieces of tape on one direction after I ripped it in the middle. And then taking the other piece and going the opposite way. Now that that's happening, I'm going to go ahead and get my syringe and I'm going to move it to 20 mLs. I'm going to connect it. I'm going to connect it to her NG, and I'm going to go ahead and push 20 mLs. And as I'm doing that, I'm listening to her stomach to see if I hear the shh in her stomach. And then after that, after I heard the swish in her stomach, I'm going to aspirate her stomach contents. It should be 1 to 5 once I test it. So I've seen her stomach acid. I'm going to go ahead and test it with my strip that I have. I'm going to go ahead and test it. Set that aside. Marie, are you having any pain or anything that I need to help? Let me adjust you in a position that's more comfortable. Her stomach contents is between 1 and 5. It's at 3, so I know it's in the stomach, but we're going to go ahead and let them take an x-ray of her stomach to make sure it's in the right placement. She came back, it is in the right placement. So I'm going to go ahead and secure her NG tube to her gown. And I'm going to ask her if she has any problems, if she needs anything. I'm going to go over the orders for her and ensure her that the NG tube is in the right placement and there's nothing else to be performed at this time. So I'm going to go ahead and ask her what position is her favorite position, but keeping her in the high fowlers. So she won't aspirate, but lowering the bed to the lowest setting so she won't fall out the bed and hurt herself. Are you comfortable in the position you are in? Okay, thank you. I'm going to go ahead and take my gloves off. And I'm going to perform hand hygiene, and I'm going to leave her room.